What are my thoughts on over-the-muscle breast augmentation? So this is an area where I have changed my thoughts over the last 10 years. So just to review, we really transitioned from over-the-muscle to under-the-muscle augmentation many years ago because of concern about increased contracture rates and other complications for over-the-muscle. The best data we have show that the complication rates were less when we put implants under the muscle, so that's what we did. So the first 10-ish years I was out from my training, I did pretty much all dual plane augmentations. And I did that because I wanted to minimize the chance of complications for my patients. But the one thing I noticed is that patients really don't like under the muscle augmentations. The muscle movement bothers more people than we really care to admit in the plastics community. Even if you don't have over-release of the muscle, a double bubble, or like real muscle-related complications, just the movement is weird. It's not normal to see your chest move like that every time you move your arms. It just looks odd and patients don't like it. There's also a lot of patients that are uncomfortable having the implant under the muscle, especially if you're very body aware and you do a lot of exercise like Pilates or yoga. They don't like it. It feels weird and they weren't happy with it. So there has been this transition back to over the muscle in the last 5-6 years or more. And that's both in the reconstruction world and also the cosmetic world. And probably the biggest driver is our patients. They just don't like under the muscle augmentation. So our goal is to figure out how to give them what they want without that increase in complication rates. So in the current year 2025 of our Lord, we know more things about what caused some of the complications we were seeing increased rates in when it was over the muscle augmentation. So incision placement is very important, using irrigants in the operating room, Keller funnels, using shields in the operating room. There's all these things that we do that help our complication rates go down. And what we've discovered is you can safely put implants over the muscle and keep those complication rates low, similar to under the muscle. And for this reason, a lot of us have transitioned back to over the muscle because patients are just happier. I'll tell you, as a human who has implants and has had them both under and over the muscle, I personally like them so much better over the muscle. Now here's the downside of over the muscle. Because you don't have that muscle over the top portion of your implant, you may see the implant edge more, especially if you're very thin. And if you're very thin, you also may see rippling of the implant. All implants ripple, 100% of them. But depending on the shape of your chest wall, how tight or loose your capsule is, and how thin your tissue is, you may or may not see it, and thinner patients are more likely to see it. But I will add that the newest implant on the market, the Motiva implants, have pretty minimal rippling and have made this almost a non-issue in my patient population. Knock on wood, I just don't see it like I used to in my thin patients. So just to review, in my practice, I've transitioned to over the muscle for both my cosmetic and cancer patients, and I find that patients are much happier with that, and I'm much happier with it. And even if they have a little bit more visible upper implant edge, patients tend to prefer that, in my experience, over the muscle movement.